If osteoarthritis were only wear and tear, pain would always match the X-ray, but it doesn't. Some patients with mild structural changes have severe pain. Others with advanced changes function surprisingly well. That tells us something important. The diagnosis osteoarthritis does not explain what is driving your knee, because osteoarthritis is not one single process. Different biological drivers can produce the same label, and unless we identify the dominant driver, treatment becomes generic. Today, I'm going to show you the map. Modern research shows that osteoarthritis has multiple biological phases. In medicine, we call these phases phenotypes. A phenotype simply means the dominant mechanism driving the condition. Once we identify that mechanism, treatment becomes more precise. Let's go through the major patterns. Metabolic or immunometabolic OA. In this type, the driver is systemic metabolic stress. You often see central obesity, high triglycerides, borderline sugar levels, and insulin resistance. Inflammation begins within the body and affects the joint. Pain may feel worse than imaging suggests. In this phenotype, correcting metabolism becomes foundational. We will explore this type in depth in the next video. Synovitis dominant OA. Here, the joint lining becomes overreactive. It produces inflammatory chemicals that irritate the knee. Patients often describe rest pain, night pain, and episodes of swelling. Inflammation is leading the process. Treatment focuses on calming that inflammatory activity. Aging or inflammaging osteoarthritis. As we age, repair efficiency declines. Cartilage renews more slowly. Bone beneath it stiffens gradually. Pain develops progressively rather than suddenly. This phenotype requires preservation, strength maintenance, consistent movement, and support of repair potential. The goal is maintaining independence. Post-traumatic OA. This follows injury. Meniscal tears, ligament injuries, previous surgery. The joint never fully resets. Load distribution changes. Biology adapts. Treatment must address both mechanics and biology. Ignoring mechanics limits recovery. Load sensitive or stress responsive OA. In this type, the issue is not only damage, it is how the joint reacts to stress. Some knees tolerate load quietly, others overreact. Even normal walking or step climbing can trigger disproportionate pain. You often see this in bow leg or knock knee alignment, flat feet, weak hip stabilizers, or post meniscus surgery knees. Here, mechanical stress amplifies inflammation. Treatment must improve how the joint is loaded and how it responds. Cartilage dominant degeneration. Here, cartilage itself is the primary weak link. Sometimes influenced by genetics, structural preservation becomes critical. Early intervention matters. Subchondral bone dominant OA. In this type, the bone beneath cartilage becomes stiff and reactive. Shock absorption changes. Pain may feel deep and heavy. Treatment focuses on improving bone behavior and restoring load balance. So, what does this mean for you? Means your knee pain is not random. If your pain feels worse than your X-ray, it may not be simple wear. If you have rest pain or swelling, inflammation may be dominant. If your knee worsened after injury, mechanics may be leading the process. If you have high triglycerides, borderline sugar, or central weight gain, metabolism may be amplifying your pain. Instead of asking, how bad is my arthritis, start asking, what is driving my arthritis? That shift in thinking changes everything. Because once the dominant driver is identified, treatment becomes focused, not generic, not trial and error, but strategy. Now, I would like you to reflect. Based on what we have discussed today, which pattern sounds most like you? Comment below. If someone you know has been told it's just wear and tear, share this video with them. Understanding the pattern is the first step toward changing it. In the next video, we will take one of the most common phenotypes in India, metabolic osteoarthritis, and examine it in detail. And many of you may recognize yourselves there. I am Dr.A.K. Venkatachalam from the Madras Joint Rejuvenation Center. Let's move from generic treatment to precision joint care.